automatically dispense you the generic version of a medication. So there's a little spot on the prescription where the prescriber can say whether the name brand is required, and if not, the pharmacy should automatically give you the cheaper generic version. So prescription medications are prescribed specifically for you. Um, and this is very important. I see this every day at the clinic and elsewhere too, where people take other people's medications that was prescribed to their mom or sister or their roommate, and they think, oh, that medication works just fine for that other person, so they can try it too. Um, that could not be farther away from the truth, and we really, really caution and try to teach people to not do this. You know, you may need a different medication, you may need a different strength for the same complaint, you may need a different dosage or different length of treatment, or you may not need medications at all. I see this all the time where people come in with an upper respiratory infection and they want antibiotic. Well, their roommate, let's say, may have gotten antibiotics because based on our evaluations, we determined that that person has a bacterial infection that does warrant antibiotics. But they may have a viral infection. So viral infections do not require antibiotics. So not necessarily, if you're presenting with similar symptoms as somebody else, you may not need the exact same medication. So please don't take their medications. You may be allergic to an ingredient that that other person was prescribed. And so that may not be the appropriate medication for you, and we would have to substitute with a different medication that you don't even know about. It may interfere with other medications or medical conditions. Let's say, your mom has high blood pressure. Well, she may not be able to get the same decongestant as you who do not have high blood pressure. So, you know, apples to apples really is what I always say. Just don't assume that just because something worked for somebody and was appropriate, then it's good for you too. Um, okay, allergies I did mention. Current medications, yes, a very important point when it comes to you getting a prescription for medications is that you need to tell the provider what kind of current medications you are on, and it includes over-the-counter and other, vitamins, supplements, and other medications, because medications interact with each other. So whatever was prescribed for somebody um, may not be appropriate for you just because you are taking something else that could hinder the absorption or the elimination of that medication. So those are very important points. Label warnings. Um, so nobody reads these, obviously, but they are super important. They do give you very helpful information about proper storage. They will tell you, does your medication need to be refrigerated or stored at room temperature? It does matter. Whether you need to take it with food or avoid certain foods with it, or you need to take it 30 minutes prior to your first meal of the day, like with a reflux medication sometimes. Do you need to avoid alcohol with it? It may cause dizziness, so you should be very careful if you're driving and those sorts of things. So look at the label when you get your medication dispensed from the pharmacy. Make sure you look at it and heed those precautions, okay? Let me click. Okay. I cannot emphasize this enough, that if you are unsure about something related to your medication that was prescribed to you, ask questions. Ask before you leave the room, or if you remember afterwards, ask questions. Call. We will be very happy to answer all sorts of questions. Our clinic has an after-hour on-call nurse that can either answer questions or direct you to somebody who can. You can call your prescribing provider, you can call the nurse, or your best friend, honestly, a lot of times is a pharmacist. You can always call them if you have a question about your medications. Um, you may want to take a picture of this in case you haven't utilized this number. This is the after on-call nurse, and we do get a report of every person that calls in during after hours. We review those, we contact the students back to see if their questions their problems have been resolved, or if they still need any questions. And so we are in contact with this on-call service. Now, besides the label that's on the outside of the medication bottle or box, there's also an information sheet, like a leaflet, that's inside the medication container. And I know it's got lots and lots of very small font on it, and most people don't read it. However, if you do encounter any kind of side effects, for instance, or are worried about any possible adverse reaction because you're not sure what is normal, what isn't, your first clue would probably be on that sheet, because it will detail what kind of common side effects are, what kind of adverse reactions can be expected, what kind of interactions to watch for with other medications. And again, if you're not sure, just call somebody, okay? As far as what is normal, what is not normal, I just wanted to kind of point out a few things that I commonly see. You know, a lot of people will say, well, I get a yeast infection frequently after antibiotic use. Well, if you know that you do that, if you mention it to me, I often just give you something so you wouldn't have to come in for an extra trip. It is sometimes, it's not normal, but it's not unexpected a lot of times in females. So there can also be information found on how to prevent or cope with diarrhea, nausea, drowsiness due to medications. What do you do if you develop a rash? Certain rashes don't really require any medical attention, but some do. So some do require you coming into the clinic or see your provider or go to the ER. What reactions warrant calling 911 or a trip to the ER? Not all of them do, but we see people run to the ER for all kinds of things all the time. What other medications or foods do you need to avoid to prevent adverse reactions, for instance? Sometimes grapefruit interferes with the absorption of certain medications, so these could be important things. And ideally, your provider will point all this information out to you, but sometimes there's just not enough time, or the provider does mention it and you forget half of what was said in the room. I do all the time too. It's not uncommon when a lot of information is dumped on you all of a sudden after diagnosis. It's hard to get overwhelmed with all the information that's given. We try to give printed patient education information at the clinic so that you can review those after you go home, you know, in your own room or at home when you actually have time and are more likely to retain that information. What to do if you feel like you can't tolerate a prescribed medication. We see a lot of times where we give, especially with antibiotics, we give antibiotics to somebody, and let's say they come in 2 weeks later with the same problem, sometimes even worse. And we ask them if they had completed the prescription that was, the medication that was prescribed for them last time, and they'll say, well, I stopped after 2 days, whereas it would have been, let's say, a 10-day course, because I just didn't like it. It made me nauseous, or I didn't like it. So if you feel like you're not tolerating some kind of medication that your provider deemed necessary for you to get better, please contact us. There are usually helpful tips that we can tell you. You know, if you get nauseous, take it in the evening, take it with food. We can give you nausea medication, or we can possibly, you know, switch to a different kind of medication that will still cure that problem that it was prescribed for, versus just letting it go. Because a lot of times, if you take a little bit of antibiotics but don't finish your course, the bacterial infection will come back with a vengeance, and things are going to be a lot harder to treat. Some antibiotics do interfere with the effectiveness of birth control, and I do try to remember to mention this to all my students who are on birth control if I give them antibiotics, to remind them to use backup contraception. It's not with everything, but it's better to be safe than sorry. So we've had students that got pregnant on antibiotics just because they didn't use backup contraception. So that's very important also. Okay. So make sure to take as directed. It should be self-explanatory, but we see this all the time again. You need to take it. If something was prescribed to you, you need to take it either as needed, The label should say that. Let's say you get nausea medicine, take it if you feel nauseous, or for a specific amount of time. Some need, especially antibiotics, those are very, very important to take until they're all gone, even if you start feeling better after a few days. Some medications need to be tapered, and abrupt discontinuation will cause withdrawal symptoms. Um, Mental health medications, antidepressants, notorious for this. If somebody has been on, let's say, Zoloft for years and all of a sudden they run out or they just decide, okay, they don't need it anymore and stop cold turkey, it can land you in the ER because you're going to think you're about to have a heart attack and just be miserable. Yes, finish entire course even if your symptoms resolve sooner, especially with antibiotics. There's another thing that a lot of prescribers don't specify, but I like to tell my students that if something is written as twice a day, a medication, especially with antibiotics or antivirals, twice a day means preferably around every 12 hours. It does not have to be 12 hours to the minute, but try to take it at 8 in the morning or 8 in the evening, 10 in the morning, 10 in the evening, whatever fits your day schedule. But not like take it at 11 and then take it at 3. That's not really the optimal way to take it. The medication should be fairly equally distributed throughout the day. And the same goes for 3 hours a day. If something is prescribed for 3 hours a day, that should mean ideally about every 8 hours. Again, it doesn't have to be to the minute, but try to space it out equally. That's how they work the best. Do not exceed maximum usage limit. Follow up with provider as recommended for monitoring. Certain medications require constant monitoring your liver enzymes, your kidney enzymes, monitoring your white blood cells to make sure that your infection is resolving. A lot of things do need monitoring, even certain things like anemia. We want to recheck your hemoglobin and hematocrit. What was the other thing that I was thinking about? Just very basic things that, oh yes, like vitamin D deficiency, that's not necessarily a requirement, but in the time of COVID, we encourage people to get their vitamin D levels checked. And if you are deficient, if we prescribe you vitamin D supplements, it's a good idea to get it rechecked just to make sure that you're on the right dose. Use only on body parts that is prescribed for. So very important, especially with steroid creams. Steroid preparations can, thin the skin if it's used extensively or on the wrong side. It can cause skin discoloration. It can cause skin atrophy. So if we give you a cream, let's say for a rash that we think would respond to a steroid cream, please don't just use it without asking your provider on your face or wherever. Certain steroids especially are not really supposed to be used on the face. So you can do more damage than help by not contacting your provider and not clarifying that. Do you need to take that medication with, prior, or without food? Which helps absorption, which interferes with it? Very important. Again, if you're not sure, you can check the label, the medication leaflet, or you can ask your provider or even the pharmacist. So know your prescription plan. It helps because certain certain insurance companies or insurance plans may prefer a 90-day supply. And if I give you a 30-day supply of, let's say, birth control pills, something that you're on over long term, insurance may not cover it if you only fill 30 days at the same time. So let us know, and we'll be very happy to, if it's appropriate, obviously, we'll be very happy to give you a 90-day supply or send it to your pharmacy of choice. A lot of people don't know, but prescription medications, the prescriptions for prescription medications can be transferred in between pharmacies. We see this all the time where students call and say, well, I was in Valdosta and then now I'm back home in Atlanta, and could you please call it into my Atlanta pharmacy? Well, if you already have if it's a recurring medication, but You can just go ahead and go to your preferred pharmacy, let's say in this case in Atlanta, and tell them, I do have a prescription for this and this medication at the Publix on Ponto in Valdosta, and I would like to get it transferred. And pharmacies will do that in between each other. So you don't necessarily need to call the provider. We may not be able to get back with you for 2 days. If we're super busy, usually we try to, take care of these within 24 hours. But you can just go ahead and call the pharmacy and have your prescription transferred. Now, students who travel a lot sometimes forget where they had their prescription transferred last time. So sometimes we have to do a little hunting and call a few pharmacies before we find out where the rest of their refills are. But you can also just look at your medication bottle and it will say where it was filled and how many refills you have left on that. We do have a pharmacy at VSU at the health center, and we have very limited hours and inventory. So if you know you're going to be out of town on vacation, going home, going overseas, wherever, plan ahead if you travel. Okay. We don't want anybody obviously to go without their medication just because let's say they run out of their birth control on Friday afternoon they notice, and then they start panicking because they can't have their prescription transferred during to their pharmacy of choice on Saturday because our VSU pharmacy is closed over the weekend. We are not open, so we won't be able to, handle any transfers. So plan ahead if you know. Typically, I tell students, don't wait until you're down to the last pill. Make sure that once you start your last bottle, when you're about halfway through, you make sure that you have it transferred wherever you will be, when that's gonna run out. So, over-the-counter medications. Does anybody have any questions before I go on to the OTC meds about prescription medications in general? No. Okay. So let's talk a little bit about over-the-counter medications. These are sold obviously without a prescription, hence the name. They may be cheaper than prescription medications, but sometimes you need to show an ID in order to get it, even though you don't need a prescription. For instance, cough medications or certain decongestants, just because they can be abused. So the pharmacy likes to keep track of, who buys and how much. Maybe cheaper than prescription preparations. However, sometimes a prescription helps to reduce the cost. Beware of combination preparations. This is one of my pet peeves too. It's very easy to exceed maximum daily doses if you take combination meds, and the students tend to love Dayquil, NyQuil. Like Dayquil, for instance, has pain medication, fever reducer, cough suppressant, and a decongestant in it. Sometimes they will take it for just a plain headache. And I tell them, if you don't have a cough, don't take something that's got cough suppressant. If you're not congested, you don't necessarily need that decongestant. If you don't have any fever or pain, you don't need an analgesic or an antipyretic. You may just need a plain cough medicine if that's your only symptom. For instance, Dayquil has acetaminophen in it, which is the same as Tylenol. So if they take extra Tylenol on top of it, the chances of getting injuring your liver is much higher. So if we give you, let's say, Claritin D, that's already got an antihistamine and a decongestant in it, you don't need to take your regular daily Zyrtec or Claritin, because then you would be doubling up on the antihistamine part. So combination medications can be very dangerous if not used properly. So I always say, don't take, more is not always better. Don't just take a combination preparation just because that's the only thing you have in your room, or that's the name that you hear everybody take around you. No need to take more medications than what your symptoms require, really. And they also tend to be more expensive, honestly. The plain old Tylenol for a headache is a lot cheaper and a lot safer than taking, Dayquil, for instance. Don't forget to mention these to the provider. So when we have students come into the clinic and work them up, ask about their symptoms, when did it start, what have you tried to take on your own? A lot of times people say, oh, I haven't tried taking anything. And then when we ask in detail, well, it turns out, yes, they've taken X, Y, and Z medications. They just didn't really consider those medications because they're over the counter, but they are also important for us to know. Like, let's say somebody comes in and their temperature is perfectly within normal limits. Well, if they took a Tylenol or ibuprofen half an hour before they came in, their medication may be falsely low just because of that ibuprofen or Tylenol. They could be having a raging fever otherwise, and a lot of times, students forget to mention these things, so we specifically try to ask them. Our pharmacy at VSU carries several over-the-counter products. You don't need a provider to get these and try these. So let's say you are just having a little cough, for instance. Now, cough may not be the best example this time during COVID because that could be a sign of COVID. So you may want to get tested. I'm just trying to illustrate the fact that, or let's say you have a little congestion. You can try to come into our pharmacy or any CVS, Walgreens, Walmart, wherever, and just get over-the-counter products and try to see if you get better before you actually come in and see a provider. We very often see students come in saying, well, I wanted to come in because I have been having a headache since this morning, or I have been having a little cough or stuffy nose since this morning. Well, we don't mind seeing you, obviously, and it's a good idea to rule out causes that would require further action. However, it's generally advisable to try over-the-counter medications before you come and see us at the clinic. All right, let's go to the next slide. Okay. Again, read labels to ensure safe use. More doesn't necessarily mean better, as I said before. Even OTC meds can cause harm if overused or overdosed. A good example would be Afrin nasal spray. We frequently see where students use this when they have nasal congestion. It's awesome. It gives you very quick relief, and the problem with that medication is that if you use it for longer than 3 days, or especially longer than 5, it can cause rebound congestion. So it says it on the box, but nobody reads the box. So it is an over-the-counter medication, but it can do more damage again if you're not using it like you're supposed to. And again, if you still have questions after reading the label, talk to your healthcare provider, nurse, or pharmacist. They are your best friends. Some over-the-counter drugs can also interact with food and beverages. You would not think, you would think, oh, it's available to anybody over the counter. What harm can they do? I'll just pop some and see if I get better. Some examples that I wanted to give you whoops. Sorry, something popped up on my screen. So some examples for this would be avoid alcohol, dextromethorphan, or drugs that treat sleepiness. If you drink alcohol with these, you can get extra sedated and impair your ability to drive or make decisions, and that's just not a good idea in general to take alcohol or to drink alcohol with anything, but especially with these. Another example would be do not use drugs that treat sleeplessness if you're taking prescription sedatives or tranquilizers. Check with your doctor before taking products containing aspirin. If you're taking a prescription blood thinner, or if you have diabetes or gout, they can make things worse. They can cause too much bleeding. Do not use laxatives when you have stomach pain, nausea, or vomiting. Another example would be, unless directed by a doctor, do not use that nasal decongestant if you are taking a prescription drug for high blood pressure or depression, or if you have heart or thyroid disease, diabetes, or prostate problems. Those nasal decongestants can interfere with a lot of things and make your other conditions, for instance, high blood pressure, higher. Now, most people who have high blood pressure, which is a chronic medical issue, already know this, but not everyone. And it can cause your blood pressure to be really elevated, which is not good for your heart. So typically, we try to give different medications for decongestants, ones that don't absorb systematically as much, tend to be better for people with high blood pressure, for instance. Over-the-counter drugs may affect older people differently too. Now I know that I mostly see younger people at the clinic, but I realize this presentation is for faculty staff also. So it's important to note that the body changes how it absorbs foods and drugs as it ages. And older people generally take more medications than younger people. It's also called polypharmacy. So they put them at higher risk for adverse reactions. You know, the more you take, the more chances are that they will react with each other in a way that that is not preferred. And also, as your kidney ages and your liver ages, medications don't either absorb as well as they used to when you were younger, or they don't get eliminated. And when they don't get eliminated, let's say your kidneys don't work well, then things can accumulate. Like medication can accumulate in your bloodstream and your system, and they can cause toxic effects. So that's very important also. Another reason why not to take um, the same medication that, let's say, your grandma or your parents were prescribed if you're younger. All right. Any questions about over-the-counter medications? And we're going to move on. So I didn't want to spend too much time on this category, but I just, Catherine, no, thank you. But I just wanted to just just mention them because they are important. That other preparations with medicinal properties can include vitamins, daily supplements, herbal preparations. They're very often not approved by FDA, so the purity is not guaranteed. They could be laced with all kinds of heavy metals, toxins that you may not know. They also are very important when we're considering medication interactions. So please, please, please mention these to your provider that, yes, I'm taking extra whatever vitamins, or I'm taking kava kava when you get, let's say, mood stabilizers, or I take St. John's wort if you're getting, let's say, an antidepressant. Uh, Please mention them. Some of them have blood thinning properties, and so if you are already taking aspirin or other blood thinners, those dosages may need to be adjusted based on the extra non-medications that you are taking. They can also cause hormone disturbances. That's very important, especially for females. And there is an overdose risk. A lot of people during this pandemic have started taking lots and lots of vitamins. Certain vitamins are water soluble, meaning you can't overdose with them because you're just going to be at the extra excess. For instance, vitamin C. However, there are other vitamins that are fat soluble, and these are the DEAK vitamins. And a lot of people have been taking vitamin D recently to kind of boost their immune system, which is good. But if you take too much of that, you can develop vitamin D toxicity. So again, if you're not sure what is safe, check with your provider, or don't take it until you're sure. I personally, and I know this is not on the slide, but when somebody tests COVID or is exposed especially, I recommend them, or even just for pure maintenance, I recommend them taking extra vitamin C, vitamin D, and zinc to help boost their immune system. But there is a safe limit for especially vitamin D and zinc. So that's important to know. All right. I wanted to take a moment to kind of draw your attention to our pharmacy, which a lot of people don't know about. But we do have a retail pharmacy, which is located inside the Student Health Center building. You may want to take a picture of this if if you need it later. But this information can also be found on the VSU Student Health Center's website with the phone number and the hours. Now, hours may change, especially during the summer. We accept cash, credit, debit, and flex, and we do sell more medications and non-medications or supplies than people would realize. So you don't necessarily have to go off campus to buy over-the-counter medications. We also obviously sell certain prescription medications too, but we sell a lot of OTC meds, vitamins, supplements, wound care supplies. And a lot of extra like thermometers, pregnancy tests, ice pack, Epsom salt, sore throat lozenges. I listed a few here, even hand sanitizers, ACE wrap. So it's a really good resource for anybody who wants to come and buy things there that they don't have to go off campus. The pharmacy is available to students, faculty, and staff. So not just students. Any faculty and staff can also come in and buy, let's say, cold medication if they feel like they have symptoms. Now, over-the-counter medications can be ordered online. I'm sorry, prescription medications can be ordered online and or no, okay, take that back. Over-the-counter medications can be ordered online and picked up at the pharmacy during pharmacy hours. We do have students who pay for and order, on, let's say, Plan B online, and then they just come in and grab it. It's a very easy way to avoid um, spending too much time there. But for faculty and staff, especially, who are, let's say, on a blood pressure medication or some kind of preventive medication, like for a chronic medical issue, um, if they call our pharmacist can place a special order for them, and they may be able to pick it up within the next business day. Um, so let's say you don't want to fill your blood pressure medication somewhere else. There is an opportunity that if you call our pharmacist, Emily, who is super helpful, that she may be able to get it for you, and you can just come and pick it up at our pharmacy. Now, our pharmacy does not take insurance though, so that may be a bottleneck because we don't file insurance, so you just pay a cash pharmacy. So it's worth just checking with Emily, our pharmacist, to see how much she could get it for you, because you may be surprised that you could possibly still save money by not using your insurance. And I think there's another slide um, that I will talk about this on. All right, time for medicine cabinet checkup. These are just general good advice um, for everybody to look through your medicine supply at least once a year, toss out what had expired, make sure that they had been kept properly, keep them locked away from children or other people, possibly, if they are around, and make sure that all the medications are in the correct bottle. It's typically not advised to pour your medications over into different little Ziplocs, pill containers, bottles, um, more than just a few days at a time, because you may forget what's in them, and then somebody may assume it's something else, or you may assume it's something else, and then take them when you're not supposed to. So keep them in their original medication containers if possible. All right. These are just a couple of apps that are popular, but there is a bunch more. Honestly, I don't want to spend too much time on this slide. Um, Today's generation obviously loves apps and everything electronic. So there are apps for reminding you to take your medicine, to keep track of your medications, to keep track of your menstrual cycles. There are apps for everything out there. A lot of times they're free. So just browse around if this is something that you're interested in. Okay, a quick list and this is actually a two-page list, so it's not a short list, of things that we recommend that every college student should have in their first aid kit. A lot of times people come in and they tell me they have no idea if they've had a fever because they don't have a thermometer, or they haven't even tried to take a Tylenol or ibuprofen for their headache because but they don't have one. So this may be more for parents, but we recommend that students have a little basic first aid kit with them when they come to college. That includes Tylenol, ibuprofen, antibiotic cream, cough or cold medicine, eye drops, hydrocortisone cream. I'm not going to read them out. You can read them too, but they are super important when people move out of their parents' home and have no idea what it's for what. When my oldest one moved off to college, I made him a little box and I wrote down, this is for this. This is what you can take if you have this. This is the dose from this. highlighted. If you have to take it with food, like ibuprofen, don't take it on empty stomach. Um, the list continues. These are not medications, but medical equipment. Then obviously, pulse oximeter is nice to have, but if you feel like your oxygen saturation may be low, come into the clinic or see an urgent care provider so we can evaluate you. Don't wait until your O2 set goes down to the 80s. All right. A little bit about cost. We're almost done. Um, so obviously, if you qualify for subsidized insurance, Medicare, Medicaid, each state, know that there are resources where you can fill out applications and apply to them. We do not accept these insurance at the health center. However, your healthcare fee may cover your visits if you're just coming in and don't need any labs or medications. Or you may be better off if you need a lot of lab work, for instance, to see an outside provider who does take these. You can save by using generics versus brand name medications if applicable. Um, you can save a lot of time, a lot of money, sorry, by being aware that pharmaceutical companies do have assistance programs. A very good example for this would be we had a student a couple of weeks ago who has chronic asthma, and his inhaler is between $200 and $300 a month. He wasn't able to afford it, so we helped him apply for an assistance program where he's going to get it for free. But you can do this on your own as well. Mail-in orders tend to be cheaper a little bit, and we do encourage, to a certain extent, obviously, to shop around. One pharmacy may have better prices than another one. So if you go on, let's say, Publix or Walmart's website or Winn-Dixie, they do have medications that they can give you for, like, let's say, $4 for a 30-day supply. And just, you can compare and compare these medication list and see where you can save. Even a few dollars a month can add up, especially if you're taking a lot of medication. And a number of states offer medication assistance programs for seniors and other people who cannot afford medication. So use those. All right. And my last slide, I believe, is also on saving. Have your insurance card ready when filling your prescriptions at outside pharmacies. As I mentioned, our VSU pharmacy does not take insurance. And know your prescription copay. Sometimes it's cheaper to not use your insurance. Use GoodRx. I highly, highly recommend it. We do have a little savings card at the clinic that I give to students, but you can access it through the internet. They have an app, or you can just pull it up on your internet browser, where you can compare prices in your area and access coupons on your phone. They're perfectly free. A lot of times you don't even have to print the coupons out. You can just show it to the pharmacist on your phone. It will tell you on this little example, for instance, the same medication at Kroger is $6, at Walgreens is $18. So there are big differences. And lastly, opt for store names whenever it's possible, store brands whenever it's possible instead of name brand versions. Zyrtec is very popular, obviously, but the generic version, the store brand generic version, is just as useful as the name brand and a lot cheaper. So I think that was my last slide. These are my references. Yes. So that concludes my little presentation. Does anybody have any questions? I don't know how to get the slide off of here. Does anybody have any? Oh, thank you. Okay. Well, in that case, no question. Thank you. You're very welcome. And yes, please, even if I left something out that you just think of later, don't forget to call me. I'm available at the health center, or shoot me a message via email, or talk to your primary care provider, and we will be very happy to help you out. So thank you so much for coming and listening. listening to my presentation. What do you recommend when throwing out expired prescriptions? Suzanne, that's a very good question. So I recommend checking with your pharmacy because a lot of times they can dispose safely with your medications. I typically don't advise dumping it just straight in the trash, especially if there are children around or dogs or like other animals. End up in the landfill and soil and cause issues with that. So my first tip would be to go ahead and check with your pharmacist and see if they can dispose of it for you. Now, I know that certain opioids, for instance, pharmacies or certain controlled substances, the pharmacies will not take. And I actually ran into this problem when I had some controlled substances from my daughter's spine surgery left over that we didn't use. And the pharmacist said, sorry, we can't take it because it's a controlled substance. So what they recommended was to kind of put it into ground coffee and throw it away like that. I guess it softens it up and breaks it down so people cannot pick it out of the trash and use it or sell it. But your pharmacist is your best choice really for that kind of question. Any other questions? All right. You're very welcome. All right. Everybody have a safe day and enjoy the rest of your week. Bye.